You are not just thinking about how you will give birth. You are trying to understand something that is difficult to put into words. Whether your body is truly progressing in the right direction, or whether what you feel is only a temporary sensation, creating a false sense of progress. Because at this stage, what misleads you most is not the pain, but the familiarity of it. It feels like menstrual cramps, like pressure, like something you have experienced before. And that familiarity is exactly what delays your recognition that something entirely different may have already begun inside. And what matters is this: your body does not wait until the day of labor to decide. And that process often begins weeks earlier. In the final stage of pregnancy, the uterus starts having mild contractions to practice, while hormones such as prostaglandins gradually change the structure of the cervix from firm and closed to soft and more flexible. When the baby's head descends and aligns with the correct axis, the force of each contraction is no longer dispersed, but directed efficiently toward the cervix. At that point, each contraction no longer creates only sensation. It creates measurable change. Vaginal birth and caesarean section are often presented as two choices, but in reality they do not exist on the same plane. For comparison, one is a biological process that functions only when conditions are appropriate, while the other is an intervention used when that system is no longer operating safely. And what makes the decision difficult is not a lack of information, but the attempt to choose an outcome in advance. While your body operates in real time, contraction by contraction, change by change. When true labor begins, what you need to observe is not how intense the pain is, but whether it has structure. A proper contraction comes, builds, reaches a peak, and then subsides, creating a necessary period of rest. That rest is not optional. It is a physiological requirement that allows blood flow to the placenta to be restored. In this state, the force of contractions is not wasted, but transmitted from the top of the uterus down to the cervix, gradually opening it. And as the cervix opens, the baby moves downward in a directed way, not randomly. In this condition, biological benefits arise naturally. The baby's lungs are compressed to help expel fluid. The immune system is activated through microbial exposure from the mother. And for you, oxytocin helps the uterus contract effectively after birth, reducing the risk of bleeding. These are not added benefits, they are direct outcomes of a system functioning correctly. But these benefits do not sustain themselves automatically. They depend entirely on whether the process continues to progress. If contractions occur but the cervix does not continue to open, if pressure increases but the baby does not move downward, then force is still being generated, but it is no longer being converted into effective change. At that point, pain is no longer a sign of progress. It is a signal that the system is losing efficiency. One critical factor: each uterine contraction temporarily reduces blood flow to the placenta for a few seconds. When the contraction ends, blood flow returns and the baby continues receiving oxygen. So this cycle is only safe when there is sufficient rest to compensate for that temporary reduction. If contractions become too frequent, prolonged, or continue for hours without progress, the baby's ability to adapt gradually declines. And once it crosses a threshold, risk does not appear suddenly. It accumulates over time, whether you feel it or not. Fetal heart rate is one of the most direct indicators of this state. When it remains stable, the system is still compensating within safe limits. When it begins to change in an unfavorable direction, it is no longer a normal fluctuation. It is a sign that the body is losing its ability to compensate. So at that point, time is no longer neutral. The longer it continues, the more risk accumulates. And this is the point at which caesarean section is no longer the easier option, but a necessary response when the natural labour system can no longer ensure safety. It removes the ineffective mechanical process and delivers the baby through another route. A caesarean section is not absolutely safer. It is only safer in the right context. When it replaces a process that is no longer effective. In a caesarean birth, you do not experience rhythmic contractions, but you may still feel pressure, and pulling sensations. For the baby, there is no compression through the birth canal, so fluid in the lungs may clear more slowly in the first hours. This is a real physiological difference and is usually monitored. The greatest difference lies in recovery. Vaginal birth utilizes the body's natural biological system, while a caesarean section involves recovery from a surgical incision through multiple tissue layers with higher risks of infection, adhesions, and blood clots. The uterine scar also affects future pregnancies and how they must be managed. Episiotomy is also often misunderstood. When tissue is stretched to its limit and at risk of uncontrolled tearing, a controlled incision can limit damage and improve recovery. Its value lies in timing, not in the act itself. So the real question is no longer which is better, but what state your body is currently in. If the cervix is opening steadily over time, contractions are rhythmic, there are rest periods and progress is evident, you continue. But if contractions become frequent without adequate rest, if pain continues without producing change, if your body begins to exhaust, or if signals such as fetal heart rate indicate declining compensation, then waiting is no longer neutral. It becomes a risk factor, so the right decision is not the earliest decision, but the one made at the right time. So when you understand the difference between progression and stagnation, you are no longer trapped between two choices. You stop trying to hold on to an initial plan and instead begin observing what is repeating. And when a pattern becomes clear enough, it is no longer a possibility. It is a state that has already formed and it will continue according to its own rules, whether you are certain or not. Waiting does not make you safer, it only makes you slower than what your body is already signaling. If you are still uncertain, that is not a reason to delay. It is a reason to check immediately, because once the system has shifted into inefficiency, every unit of time reduces the margin of safety. In situations like this, timing is more important than absolute certainty. And when you can read your body's signals, whether the outcome is vaginal birth or caesarean section, it is still the right decision, because it is based on the real state, not on emotion or assumption.